Dr. Christopher Ahmad, and I'm the Fellowship Director at Columbia Orthopedic Sports Medicine. I'd like to share with you some of the great features of our fellowship. First is the extreme commitment of our outstanding faculty to fellowship education. We've employed a mentorship model where the fellow gets an opportunity to work one-on-one with each of our attendings, learning their exact indications, their specific surgical techniques, and really the reasons behind their excellence. Our fellowship also features exposure to various subspecialties: arthroscopy of the hip, sports medicine as it relates to the adolescent and pediatric athlete, high-level care of throwing athletes. And this exposure is in the operating room and outside of the operating room. We have amazing game coverage at the professional level with the New York Yankees, in soccer with the New York City Football Club, at the collegiate level with Division I football, Division I basketball. That exposure gives a well-rounded feel so that fellows that graduate from our institution are going to be able to take care of any athlete at any level.
The mission of the Columbia Sports Medicine Fellowship is to help mold the next generation of sports medicine surgeons from an academic as well as a clinical perspective. We're hoping to create the next group of leaders who are going to be sideline physicians taking great care of patients while answering the next line of research questions so that we can continue to push the sports medicine field down the line. This is a lifetime opportunity, a chance to work with world leaders who are not only going to be there during your 1 year of training while here in New York City, but who will be part of your DNA moving forward and will be there available to you at any given moment to help you as you navigate your initial years in practice and then become lifelong friends.
We have a large group of sports attendings that each have a slightly different niche area of expertise, whether it's more shoulder and elbow, more shoulder arthroplasty, throwing shoulder and elbow versus a pediatric sports medicine type niche area. So the fellows get a great opportunity to work with each of those different attendings. We try really hard to avoid having multiple trainees scrubbed in the same case so we can maximize the educational benefit and really get you guys involved and hands-on and learning and doing at the same time.
Being a sports fellow at Columbia is unique in that you get a world-class shoulder education as well. The sports fellow spends about 4 months operating every Wednesday and focusing on sports-like cases, but also shoulder arthroplasty and fracture. And many sports fellows find the time incredibly rewarding because they know that they will be asked to do things like ladder or shoulder replacement in their practice. And this is unique in that during your first job, you'll have that tool set to tackle any shoulder problem, and you'll quickly become a leader in your department or hospital system as being an expert in sports medicine, but also shoulder.
I think mentorship gets talked about a lot. I think what it means tangibly, for me in particular too, I did not train at Columbia, but one of the draws for me to come here as a younger faculty member back in 2012 was the chance to work side by side with guys like Chris Ahmad and Bill Levine. I would say it's genuine. Those guys really care about how over a 5 or a 10-year plan you really lay out what you want to do and what you want to accomplish. Whatever they can do within their wheelhouse or realm, they are, believe me, more than happy to go to bat for you.
In the beginning, you're just learning everyone's preferences and sort of soaking it up. And then definitely as sort of those relationships grow, so does your autonomy. Most teams run 2 rooms. And so the second room is sort of your room to run. And then the other very nice thing is this fellows led clinic that's on Tuesdays, where you are the attending there. You're here overseeing the residents and booking cases out of that clinic. And when you book those cases, you're the one who is deciding on the surgical indications. You're the one who is deciding what implants to use and why. Of course, you can always run those plans by any of the faculty, but those cases are your cases. And so that's another way that you sort of develop your own autonomy and stuff.
Columbia Orthopedics has an amazing history, rich in the development of innovation in orthopedics. And now we're paving the way for some of the greatest advancements in orthopedic sports medicine, and we look forward to our fellowship carrying on the amazing tradition of Columbia Orthopedics.